Hi everyone, I am Dr. Ausaf, your medico-legal expert. Today I have come up with the mantras in practice. Yes, there are 5 mantras which need to follow for successful and stress-free practice. They are the first mantra, that is communication. Communication in the form of oral consent, in the form of counseling, in the form of explanation, or any verbal affairs between a doctor and a patient. Let me give you one example. The example of history taking is a good example of communication. Nowadays, in the form of communication, a lot of people are using digital platform like Gmail, WhatsApp, and etc. These are also form of communication. The second mantra, that is documentation. It is a written action by the doctor or patient or the relative with respect to the patient's condition. Let me give you one example that writing a notes in the hospital is a form of a documentation. The third mantra, that is communication of documentation. For example, interpretation of provisional diagnosis or investigation to the patient or the relative is an example of communication of documentation. The fourth mantra, that is documentation of communication. Example, taking a written informed consent for procedure or process or any form of the surgery. The fifth and the last and important mantra, that is preservation of the mantra. In generally, for an OPD or an IPD, we require to preserve the documents for at least 3 years, but advisable for 5 years. For an MLC, you require to preserve for 10 years, but advisable for 30 years. Let me give you one landmark judgment with respect to this preservation of documents. It was in between S.A. Qureshi, that is complainant, versus Padode Memorial Hospital and Research Center in Bhopal in 2000, the Apun party or the medical faculty. The court held that the hospital was not able to preserve the document which required for the case. And hence, the court held that the hospital was negligent because they were hiding or suppressing the facts with respect to the case, and hence they were found negligent. In short, we should follow this mantras cautiously because for a court purpose, whatever is not documented in your notes never happened regardless of whatever you have actually done to the patient, whether you do legally, ethically, morally, or emotionally. Important is to document whatever action, whatever verbal communication you have done it. Because, pen is mightier than sword. So be aware and be alert. Dare to care without fear. Remember one thing, prevention, protection, and prudence is better than prosecution. Thank you very much.